Good afternoon. I'm Megan Cantabriga. I'm a surgical nurse at Dartmouth Dermatology, the Mohs Surgical Unit. In this final report, I am giving you an outline as to why the current policy for building surgical trays needs to be updated. Surgical trays are an important part of patient safety, but also play a huge role in the effective flow and smooth functionality of our surgical unit. The current surgical tray policy proves to be inefficient for this flow by taking up valuable staff time, adding unnecessary costs, and it leads to shortages of surgical instruments, just to name a few of the problems. The importance of efficient tray preparation goes beyond infection control, patient flow, and cost. It comes down to providing the best patient care that we can give. There is a huge need for this tray policy to be updated. As I have stated before in previous documents, our Mohs surgical unit and all of Dartmouth Dermatology sees the highest volume of patient flow in the hospital. For the policy to effectively take place, it will take approximately 4 months of planning, approval, making updates to the current policy, and in all, it will cost the department $160,000. The end goal of updating the current policy is to have a surgical unit that is efficient in tray preparation, continuing to practice sterile technique, and continuing to have zero infection, increase patient flow while lowering costs, but most importantly, we want to continue to deliver the best patient care possible. So when you look at this policy and the change that is being updated, there are some needs. There are things to take into consideration, such as staff shortages and inefficiencies, the cost of a surgical tray, the lack of workflow in the OR or surgical unit, delays in operating times, stronger patient care can always be improved upon. So when we think about breaking down this project and updating the current policy, there are a lot of different players on this team. There's a lot of different personnel to work with and take into consideration of meeting with and talking with to go over the current policy and then the proposed updates. We need to talk to the chairman of dermatology, the project manager, the surgeon, the whole surgical team of nurses, the essential supply processing manager. There's so many cooks in the kitchen per se that make this whole unit run smoothly. When the trays are delivered to the unit, there are layer trays and repair trays. Within each of those packs, there are multiple instruments. Some of those instruments, yes, they are crucial. They need to stay on the trays. Others, we need to go through as a team, talk about their use, talk about if they need to stay on the tray. And if they do not need to stay on the tray, we need to send that list that has been updated by our team and send it to the reprocessing manager so those instruments can be taken off the tray. By doing that, you are going to see a reduction in the cost of our surgical trays by removing the instruments that aren't needed. That's then taking away time that needs to be spent reprocessing and sterilizing, then wrapping unnecessary instruments, in which will reduce overall cost. It also cuts down on the amount of surgical waste that is produced every day. So in the final written report that was provided to you before this meeting, you will see a timetable chart that breaks down the time of who will be doing what and when we need to see information varied by parts of the team. We can't move to one stage of the update before a previous stage has been completed by someone and approved. So after this phase of about 4 months, we're going to take a pause and evaluate what we have seen as a unit. We want to see a reduction in surgical procedure costs. We want to eliminate surgical waste. There needs to be an improvement in the flow of the surgical unit. And we need to see an elimination of time spent building unnecessary surgical trays due to improper surgical tools. We want to see the unit increase in procedures due to an updated policy that will eliminate unnecessary time spent on building trays, thus providing more surgical patients and providing stronger patient time. When we aren't spending time building the trays and putting time into the trays, we're then able to put that time into our patients, into the patient care. And when that time is added up over a day and then into a week, that can then give us time to add on one more surgery. So the budget. As I said, it's going to cost about $160,000 over a 4-month span. So for that 4-month period, the budget is going to give $5,760 to the surgical trays. $5,000 will be put towards updating the surgical instruments. $50,500 goes into the project manager's salary in order to help make this whole updating of our policy run smoothly and get to the necessary people for reprinting. $45,000 goes to Central Supply Reprocessing Manager, where she then has to communicate the new list of instruments to her team. They need to redo their packaging process when they receive our dirty instruments. Everyone needs to be on the same page in order to provide us with the correct tools that will then get packaged and sterilized and delivered back to our unit. In order for this new training to take place, for us to reduce the time that is spent on the surgical trays, we need to come together as a unit, and staff training needs to take place. In order for all the staff to be properly trained on the updated policy, it's going to cost $53,740 in order to train staff properly over the next several months, with a grand total of, as stated, $160,000. So the big reasons for needing to update this policy: there are current staff shortages and inefficiencies because of the policy. The cost of the trays is less than desirable. There's a lack of operating workflow, and that then leads to delays in operating time. When personnel are not following the current policy for building trays, and they're not seeing patients when they should be, and putting that time into the current policy to build trays, that's taking away from our unit and not providing a steady flow, which then could potentially back up surgeries. So by updating this policy and outlining when trays will be built, what will be on those trays, that will cut down on the amount of time that's put into the trays, which then we can add on to the surgical time. So as you'll see, in this whole report, it's not just one person taking the time to make all these updates. It's the whole team coming together in order to update this policy and implement it. It's going to take trial and error. It's going to take a lot of communication, but most importantly, it will have the end result of improved patient care because surgical times will be reduced. It will lessen the stress of the patient, and it will provide a more comfortable atmosphere for patients to be in. Thank you for taking the time to look at the PowerPoint and listen to the final report. Let me know if you have any questions. Thank you.